then introduce yourself, where you're calling us from all across Nigeria. Thank you.
I am Naj Samuel from Unit Africa, and I will be a correspondent for this program. First of all, there was an introduction from every participant of this distinguished program, and the host and the anchor of the program was Professor Felix Chukwuneke, the Dean of the Dentistry, Faculty of Dentistry, University of Nigeria, in Soka. So we are on the way with the program.
Because if you do not have records, if you don't have data, there is no way you can allocate resources in comparison to other disease areas. So that is why any research in oral cancer will be a good one.
This was an emphasis by Professor Felix Chukwuneke on the need for researchers on oral health cancer on the Oral Dental Series Bootcamp.
The topic of the day, which is just introduction of what oral cancer is, and as well as the etiological factors, so that when the other doctor will take over, I think the later ending of this month, he will now go something in the management and all this. So I'm highly impressed. This is a very beautiful arrangement, beautiful and a novel idea by the dental students. We now go to the etiological factors. What are the etiological factors? Me and you know that causes of oral cancer is multifactorial. Multifactorial in the sense that gene makeup, environment, individual norms and habits plays important role. That is why you see somebody who smoke, who take competition, who take all this stuff.
This was for the emphasis by the anchor on what are the etiological factors of oral cancer and its contribution with the genetic factors.
So we shouldn't forget about the genetic role, the gene makeup in processing, carcinogenous tissues in the body. Because, what is cancer? Cancer is when the body lack of contact inhibition, when the body there's a kind of injury to the tissue. And normally when there's an injury, the body system has a way of repairing. But when cancer develops, the repairing issues continue, and when they reach at a stage that they know the cells are okay, they understand themselves. But in cancer, they refuse to. That lack of contact inhibition no longer exists, and they will go haywire. That's how cancer occurs. So let's go into the etiology of oral cancer. Are you with me? Good. Now, the etiology of oral cancer. Traditionally, from the onset, there are 5 X that is believed are the things that can cause oral cancer. But in my own research, I observed that, and also, in order to prevent all this, what do? You look at basic principles for oral health care. Brush your teeth at least twice a day. When you brush, don't rush. Take enough time to do a thorough job. Use dental floss. Use the proper equipment. Use a fluoride toothpaste.
There was an elaboration on the need for dental hygiene in order to prevent oral malignancy or oral cancer.
Consider using an electric or battery-operated toothbrush, which can reduce plaque and mild form of gum disease. Because the plaque are the main problem that, especially in older people. Of course, you know that plaque are the one that actually cause this oral hygiene. The more they accumulate, the more bacteria form. subgingival and supragingival calculus and go. All these ones are the ones that cause inflammation because they trap bacteria. Bacteria, use some of these enzymes to create inflammatory process within the gum. So that's where problem develops. Then practice good technique while brushing. Keep your equipment clean. Know when to replace a toothbrush. Not every now you can use one toothbrush for the whole of a year. That's not good. Avoid parafunctional habits. Bruising, picking yourself, using your teeth to open drinks and all this and that. Before you know it, you traumatize your gut. From there, one thing leads to the other. Every person should need to visit a dentist every 6 months for oral check. Now, before we go, there's one thing I want you to put at the tips of your fingers. Apart from the 7 tests that cause oral cancer. 1, any oral lesion in your mouth that refuses to heal after 2 weeks, with or without drugs, query pre-malignancy. Do you hear me well?
Yes, sir.
Good. Then the other one, that any cancer of the oral cavity that you were not able to diagnose and treat before 40 days from the onset, metastasis has started. After 40 days of cancer in situ in the oral cavity, and there is no treatment, or metastasis starts. So that is why it is very important that everybody sees his doctor, dental surgeon, every 6 months. Yeah, because sometimes when oral cancer is about starting, you might not really know, but the routine check can, it can give a suspicious look to your dental surgeon, who can now take in and go and do some histology to find out. So these are very, very important things that you need to know about oral cancer. I think I'm done. Life is short. Smile while you still have teeth.
Thank you for joining us in this live coverage by Unit Africa. I hope you learned something. Please do not forget to like, share, and subscribe. Thank you.